Hello, and welcome to joining us for another edition of our Facebook Live updates on COVID-19 here in Berrien County. I'm Jillian Conrad. I'm with the Berrien County Health Department, and I am joined by Nicki Britten, our health officer here, as well as Dr. Loren Hamel with Spectrum Health Lakeland. Thank you both so much for being here today. We have a lot to get to, so we will dive in, but I think it would be remiss of us to not acknowledge the fact that while there is a lot of excitement, we've started out 2021 with already this year, so much good news with the vaccines on the horizon, but we also have need to acknowledge that we are still very much in this pandemic. Just yesterday, we recorded more than 4,000 deaths of US Americans due to COVID-19. And we need to remind ourselves that we're very much still in this. So I want to start out just quickly, Nicki, if you can run down the numbers here in Berrien County and tell us what have we been seeing with the trends.
Yeah, we're continuing. Thank you, Jillian. We're continuing to be pretty fortunate and here in Berrien County that we are continuing to see a bit of a downward trend. We, through the month of November and even the beginning of December, were quite concerned about what was happening with our trends. Were we getting close to maxing out our healthcare capacity? We were watching all of these numbers trend up. And then we seem to have, rounded that peak and started coming back down. And we've seen that sustained for a few weeks now. This week, we are starting to see some slight increases in our number of confirmed cases, and it's difficult to make sense of that in real time. We do know that sometimes people do delay healthcare for minor concerns over the holidays. Now that we're kind of through that holiday season, it's possible there were more people seeking testing that might not have if it was more inconvenient over the holidays. So that could explain some of what is happening. We are continuing to see lower numbers in that sustained decrease in our hospital census, which we are grateful for. And I'm sure Dr. Hamel, you'll speak to this more. There's also more outpatient therapeutics that are helping keep people out of the hospital as well. So while, to your point, Julian, we are very much in the middle of this, we still have transmission happening in our community. We still have a susceptible population in our community. We need to keep up with those preventive measures. We do also have this glimmer of hope, and I'm hopeful that our community sees that as encouragement to keep going and keep persisting with the social distancing, avoiding small groups, wearing the mask and the face covering, washing hands, all of those things, because we're still in the middle of that, even though we are also turning our attention to vaccination.
Certainly, there's a lot on all of our minds. And I think one of those things is, how is our healthcare system doing right now? Dr. Hamel, can you speak a little bit to the hospital inpatient census we've been seeing recently?
So as the number of total new positive COVID cases started to decline, we expected a decline in our inpatient census. We've seen that decline. We went from a high of nearly 80 to down into the 30s for the last 12 days. We've now ticked back up to 44, and we expected that because we saw the little uptick in the data that Nicki just talked about. And it's pretty predictable. When we see more positive cases, a few days later, we get more inpatient cases. That correlation has been present throughout this pandemic. So it's no surprise. But it is, we're grateful, it's still much lower than it was, but a little concerned that it's starting to tick up again a little bit. And we expected through the holiday season, there probably would be a little more opportunity for transmission. There are people that are getting together and a little closer than to others than they would be in a non-holiday season. We're hoping this is a temporary trend, and we're hoping that trends the other way as well. The positivity rate of tests is now running in the 9 to 12%. It ticked up above 10% here. I think it's going to stay there for a little while. That also is a predictor of what we're going to see. And sadly, we still are seeing one of our Berrien County or more of our Berrien County residents pass away most days. So to your point, Jillian, it's not over yet.
Yeah, certainly. Well, turning back to that glimmer of hope that we've spoken of, the vaccines that we know are on the market are here in Berrien County, and we are well underway with our vaccination efforts, especially those in the first priority groups. Earlier this week, Governor Whitmer and the Michigan Department of Health and Human Services did announce that Michigan would be accelerating the pace of vaccinations. and that local health departments and hospital systems would be able to move into a new phase of vaccination. Nicki, there's a lot going on with that. Can you break it down for us? What does this all mean?
Yeah, and I guess I would modify how that was framed just a little bit of we have the ability to accelerate and open the people who are eligible for vaccination. The main rate limiting step in how quickly we can vaccinate remains supply and number of vaccines available. So just the declaration on Wednesday has not necessarily coincided with more vaccine being allocated to the state of Michigan. There has been some regional variation. There are counties in the state of Michigan that are maybe less populous, have fewer healthcare workers, that have been through their 1A priority group. And those are healthcare workers, long-term care facility residents. So there were some communities in the state that were sitting ready to move to that next group of people that would be eligible for vaccination, what we refer to as 1B. In Berrien County, we are still very much working through that 1A group. We have not vaccinated all healthcare workers who wish to be vaccinated, and we do expect over time there will be even more that wish to be so. Now, that doesn't mean we have to finish one group before moving to the next. There will absolutely be overlap, but we are still constrained. We have appointments scheduled with our healthcare providers. We need to ensure that we have a vaccine for those individuals before we start allocating and getting vaccine appointments for those in those broader groups. Those broader groups that are now eligible according to the state guidance, but still dependent on local vaccine availability. It does include adults that are 65 and older. In Berrien County, especially because we are limited, we are really honing in and trying to focus on the 75 plus, because that is who the ACIP, who makes the recommendations, that federal body that makes recommendations, have carved out those 75 plus. And a lot of that is because we know that as age increases, the likelihood of mortality does increase. So we want to make sure that as we have demand that outstrips supply, that our supply is going to people most likely to succumb to COVID-19, and we're really trying to prevent those deaths. So there's other critical infrastructure workers that are on that list. It's not all essential workers, it's some. So it's first responders, it's those that work in congregate living settings like homeless shelters or jails or the juvenile center. It's child protective services, adult protective services, and educators, anybody in a pre-K to grade 12 setting, anybody employed, teachers and other staff, as well as childcare workers. So with the 65 plus all those workers, in reality, we're looking at an estimated 30 to 40,000 Berrien County residents that fit that group. So as you can imagine, even taking a start into that, it will be a while, and we need a lot more vaccine before we can make a meaningful dent in that number. So we're so glad to see a positive response from our residents, and that in the last 48 hours, we have heard from so many members of those groups of people saying, okay, I'm ready to be vaccinated. Please tell me when you're ready for me. And we are continuing to reiterate to the public, please, we have ways to track you. We have a wait list for those that are 65 plus that they can find on our website. And we will soon be having a similar registration for those who are in those critical infrastructure sectors that I just listed. We're having constant communication with employers in those sectors as well. So the employees don't necessarily need to reach out to us. We're doing that planning already. And we are working to, as we can fit into our schedule amongst healthcare workers and some of those other first priorities, we are starting to try to work people into the schedules. Again, the vaccine is the limiting factor.
Wow, it sounds like there is a lot of work that's happening nearly 24/7 to make sure we're feverishly getting the vaccines we have on hand out to the people who want them. So in the meantime, knowing that we don't have a dose right now for everybody who may want one, what can people do to prepare? Nicki, you mentioned that there was a wait list for 65 plus available on the health department's website. Is there anything else, Dr. Hamel, that you would want to contribute for what people can do to prepare?
Yeah, I'd make a couple comments along with Nicki's comments. You folks have probably seen on the news here's a state or here's a county or here's a hospital that is just sitting on vaccine. And why on earth aren't we giving these vaccines away faster? Let me just make a couple comments, some facts in Berrien County. We are scheduling and giving vaccines as fast as we get them. Number one. Number two, when you talk about immunizing healthcare workers, anybody, remember it's a 2-dose process. So we have to make sure we not only have enough vaccine for that first dose, you have to have a vaccine committed and available for the second dose 3 weeks later. Now that's complicated both for the manufacturer and also for those that are giving the vaccine. You have to make sure you're not giving vaccine at a pace faster than you can do that second dose. In terms of the healthcare providers, we have given essentially everybody at Spectrum Health Lakeland who said, I want to be vaccinated, their first dose. And we've given a number their second dose because that first dose is more than 3 weeks away. It's going to be another couple of weeks before those folks have that second dose. And so when folks talk about what proportion have been vaccinated, you have to think of this as a 3-week process, not a single dose process. And that makes it complicated, but we are not sitting on vaccine. We're scheduling everything we get as fast as we get it and are giving it away promptly. I know the health department is doing the same thing. I'd also like to underscore Nicki's point. The issue here is the supply is not as high as the demand for the vaccine. And it's going to be very complicated as we're going forward, even in the over 65 group, and you're waiting for your vaccine. I'm sure you're going to be thinking this, wait a minute, I'm at higher risk for getting the disease than that person that just got it. Or I'm at higher risk for getting very sick if I get COVID-19 than that person that just got the vaccine. Those are all, they're true. There's no denying that. There are lots of ways of thinking of prioritizing the vaccine. And we know that folks with comorbid condition, diabetes, hypertension, obesity, pulmonary disease, smokers, cancers, folks on immunosuppressants, all kinds of variabilities that factor into your risk of getting sick and your risk of dying, no question. But the most predictable single element is age. And so I certainly agree with what the governor has decided, and many other states, is we're going to have to start with age. Now, we might factor in some other risk factors if the vaccine becomes available and you have enough vaccine to start doing that. But it is almost impossible to sort through all of those variabilities. So this is not the kind of thing, sadly, that you can call your doctor and say, well, you know how sick I am or how many risk factors, I need it tomorrow. Your doctor won't have the vaccine. Remember, somebody else is paying for the vaccine and somebody else is setting the rules. What we're trying to do in our community is, to the best of our ability, within those constraints, save as many lives as we can, vaccinate as fast as we can, and prevent as much disease as we can. The goals of this, of course, are to start limiting the frequency of disease, limiting those that are admitted to the hospital, and hopefully very quickly limiting the number of people that are dying within our community because of COVID-19. And I think what the governor has announced is the right thing. We are just closing down that first 1A, getting close to immunizing those in 1A, and we have to be ready to do the rest. We are committed, along with the health department, to be side by side, shoulder to shoulder, and do everything we can to give vaccines to our friends and neighbors as fast as we possibly can. We're committed to do that. The health department has a website to register. We have an app in my chart, the Epic, to help accumulate data and help prioritize, that will roll out early next week. Just stay tuned, and we will for sure do this as quick as possible. But the rate limiting step right now is vaccine.
Absolutely.
If I may also just add, I know that there are a lot of people who are anxious and are trying to do whatever they can to either get as far up on a list as they can, or to just make sure they get a vaccine as soon as possible. And so doing those 2 steps are really important. But I also want people to know we are doing a lot of work behind the scenes to work with partner organizations, older adults that are enrolled in other types of programs, might be homebound, maybe don't have access to internet. We do have things in place for them. We're working through our network. So it's not just our 2 organizations. We are thinking through this at a very multifaceted level, really trying to put some equity considerations into this as well. So it's not just people who have access readily at their fingertips with a smartphone that are the ones who get that. We're really working through this very multifacetedly.
we're also resisting, I can just tell you personally, we are resisting the efforts to say, I want to go first. I know somebody, they're going to help me get, and we've got to do this as equitably and fairly as we know how.
That's so reassuring to know that both the health department and Spectrum Health Lakeland are really truly in lockstep as the planning is ongoing for vaccination in our community. And we're gearing up for being able to provide more and more of those vaccines as they become available to those subsequent priority phases. Before we close, is there anything else you would want to add to update to our community right now this week? Dr. Hamel, we'll start with you.
Yeah, I want to thank you for what you've already done to help limit the spread of disease in our community. Thank you so much for your social distancing. Thank you for wearing your mask. Thank you for keeping your hands clean. Please continue to do that. This is not over yet. We're still losing community members to COVID most every day. We want you to be careful. That will also help keep us all safe until we get enough vaccine for everybody. And I would also encourage you, as vaccine becomes available, take it. You know, our best chance of getting back to normal is not having everybody get sick. It's having most get vaccinated. That is just going to be really, really important. So when it comes to your time, please take your vaccination.
Certainly. Nicki, anything to add?
Yeah, I would add to those of you that are unsure if you want to follow Dr. Hamel's advice of taking the vaccine once it's offered to you, I would really encourage you to voice your concerns, ask your questions. We have a hotline at the health department where we are more than willing to talk with you, hear what you have to say. We have a whole team that understands the data, understands the development, can talk about your specific health things. If you are on the fence, you're unsure of what's going on, talk with leaders in your community, talk with the health department, talk to who you trust to really make an informed decision as to what to do. We know there's a lot of hesitancy. We understand where that comes from, but at the same time, we want to help walk alongside you so you really truly can make the most informed decision. I would encourage you, just like Dr. Hamel, when the opportunity comes, please take advantage of it. But I want to make sure that you feel comfortable in that and can be a good ambassador to your friends and neighbors as well. I would just also just like to remind everybody, some days and some weeks and even some months throughout the course of this pandemic have felt really, really long. At the same time, the time kind of goes fast. It's hard to believe we're here in January already. So some of the stress and the frustration that you may be feeling about wanting access to the vaccine and not quite having it yet, the fact that we don't have more vaccine in our community, this is going to be a short period of time. Manufacturing is ramping up. There will be more allocations coming to our state and our communities in a few weeks' time. We've been able to do a relatively good job of keeping the COVID transmission levels at a manageable level in our community over the last 10 months with the things we know that work, and we need to continue with those things that we know that work. So please be patient. Please be diligent with those preventive measures, social distancing, avoid being around large groups of other people, stick with the members of your household to the extent that you can, wear your mask, wash your hands, and then be patient. There's plenty of opportunity all the way around for us to show that collective care and concern for our community. And boy, do we need to make sure that we're continuing to show that with one another and having that patience and empathy for where we're all at, understanding we can work through this strategically, collectively, and from a place of love.
Absolutely. Well said, Nicki. I think patience and holding on to that glimmer of hope here as we move throughout the rest of January and into the dead of winter here, we will get through it together. Just as one more reminder for everybody watching today, please visit our website. It's bchdmi.org/COVID-19. There you will find many of the resources that we mentioned today, including that link for the 65 plus to indicate their interest in receiving the vaccine, as well as a sign up link for our community newsletter. This is a way for us at the health department to communicate directly with you, our residents, with updates sent straight to your email inbox. We encourage you to sign up there. SpectrumHealthLakeland.org has additional resources And again, our hotline is also available for you if you'd like to talk with one of our team members to get your questions answered. We're here for you, Berrien County. Thank you again for joining us. This has been another edition of Facebook Live COVID-19 updates here in Berrien County. Thank you.